Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast is supported by an independent educational grant from Moderna, Inc.
Hi, my name is Dr. Megan Pesh. I'm an assistant professor of developmental and behavioral pediatrics at the University of Michigan. I'm also the director of our congenital CMV developmental follow-up clinic. Welcome to this podcast entitled Getting to Know Your Child's CMV Healthcare Team. This is part of a 6-episode podcast series called Let's Talk CMV. Today, I'm speaking with Dr. Patricia Purcell. Dr. Purcell and I know each other from both working at the University of Michigan, and we also share several patients with CMV in common. So it's been great working with her clinically. And now, Dr. Purcell, it's a pleasure to have you here with us today. Can you tell us a little bit about yourself and your work with CMV?
Sure. Thank you for having me. My name is Patricia Purcell, and I'm an assistant professor of pediatric otolaryngology at the University of Michigan. And as Dr. Pesh mentioned, I work with her in the care of a number of children with congenital CMV.
That's so great. And thank you so much again for being here today. Just a reminder for all of us, cytomegalovirus or CMV, anyone can get it really at any age. It's an incredibly common virus, and many kids even get it before they're 5. Most of us adults end up getting it before we're 40. But most people actually have never heard of CMV. So if someone is unfamiliar with CMV, you are totally not alone. Once somebody catches the virus, CMV stays in their bodies for a lifetime, and it can be reactivated over and over. Kind of like the virus that causes the chicken pox, it can come back later in life. Someone could get shingles. Thankfully, CMV, most of the time, people don't even know they have it, and the symptoms are, for the most part, really mild. There are different kinds of CMV, and the ones that we're mainly discussing today are congenital CMV, and that's kind of like the exception to the rule. So congenital CMV is when a baby gets CMV through the placenta before being born. And in that case, CMV can actually be really harmful. The mother herself might not have any symptoms, but it can be harmful to that baby. Dr. Purcell, can you talk a little bit about CMV infection, actually in particular congenital CMV infection?
Sure. I think you did a great job of summarizing how common the CMV is. Because most people will get it eventually, it's not really practical to completely shelter yourself or your children from CMV. And it's not anyone's fault, and there's no blame if somebody gets the virus. One of the reasons that CMV is so common is because of how it can spread through contact with bodily fluids. So if someone has CMV, then the virus may be present in their blood, in their saliva, their tears, urine, vaginal fluids, semen, and even breast milk. Toddlers in particular, because about a third of toddlers will contract CMV during that period of their life, we know that toddlers like to explore the world with their mouths and often transmit secretions in saliva. And so that can be a source of transmission for CMV. When CMV is active, it can be easily passed to others in this way. The good news is most adults and even children who are not inside the womb will have a healthy immune system, and they'll have a primary CMV infection that may not be very severe. It may be similar to a common cold. They may not really feel sick, and the symptoms are not too bad. A person's first CMV infection is known as a primary infection. However, babies who are born with congenital CMV can have serious symptoms and complications. It's important to know that congenital CMV can affect children differently. So a small proportion, about 10%, will have symptomatic CMV. These babies will have visible signs of infection at birth. They may have a small head. They may be small for their gestational age. They may have other visible signs such as splotches on their skin. If a pediatrician notes these changes, then additional workup can be done pretty quickly. But it becomes more complicated because about 90% of babies who are born with congenital CMV may not have those visible signs. And so it can be more difficult to detect. It's not quite clear why some babies are more affected than others when it comes to congenital CMV. So the risk of complications is thought to be greatest if the mother experiences her very first CMV infection during the first 3 months of pregnancy. If there are any signs that a newborn potentially has congenital CMV, then a newborn needs to be tested as soon as possible, definitely within the first 3 weeks, because the diagnosis of congenital CMV really needs to be made within those first 3 weeks. As we've talked about, the virus is very common, and so a baby who is even 4 or 5 weeks old may actually be exposed to it after birth. And so a positive test in that setting would not truly be congenital CMV.
That's right. That 3-week time frame is key. It's important to know about prenatal exposure or exposure to CMV in the womb, which puts a baby at risk for congenital CMV. That is completely different than if a baby is exposed even the day after they're born. So once they're outside the womb, and it can really affect their organs in different ways. If a baby is exposed outside the womb, generally we don't see any symptoms, and that baby isn't at risk for long-term consequences or negative outcomes of just having that infection or that virus in their system. But if a baby is exposed in utero, the virus can really alter the way some of their organs form and even cause hearing loss. So, like you said, babies born with congenital CMV can have signs or complications ranging from pretty severe brain abnormalities to, some kids just you can't even tell. The most severely affected children, so infants, and then later, as they grow up, can develop seizures, cerebral palsy, intellectual disability, learning problems, all the way to kids who have no complications at all. And then, as you can imagine, everything in between. And as you mentioned, we also see hearing loss as something that is actually pretty common in congenital CMV, even among babies who are born looking perfectly healthy. So this all means that if you're the parent or caregiver of a child born with congenital CMV, it's important to be aware of what complications they might develop and then what healthcare team members you'll be working with on your child's care plan moving forward. So, Dr. Purcell, I think this is such a key point. When you're a parent, you have a child who may have additional needs or, is at risk for some developmental disabilities. You need to kind of gather your village, your team of healthcare providers to rally around you. So, in addition to their pediatrician, parents may be working with a whole roster of different folks. Can you tell us a little bit about who those players might be?
That's a great topic. I'm really glad we can talk about this. Yes, there's a lot of providers who are often involved in the care of children with congenital CMV. And it's really important for parents as they navigate this journey to realize that there is a support system for them in place. There are many facets to a child's growth and learning and development. And so we have team members who kind of support each one of these aspects. So, I think kind of at the heart of a child's care really is the pediatrician. The pediatrician is a doctor who has completed training in understanding growth and development of the child. And there are even pediatricians who specifically train to learn more about this process, and they are developmental behavioral pediatricians. And so they are often kind of the backbone of the support system who help to navigate all of the different team members. As a pediatric otolaryngologist, I manage the hearing loss that often is associated with congenital CMV. And another word for otolaryngologist that listeners may be more familiar with is ENT, or ear, nose, and throat. I work very closely with audiologists, who are the individuals, providers that do the hearing tests. And because congenital CMV is one of the most common causes of permanent hearing loss, it's really important for us to monitor a child's hearing over time. A number of children are identified as having congenital CMV based on the fact that they fail their newborn hearing screen at birth. And so this can be a flag that something is abnormal. And in many institutions, it prompts a workup for congenital CMV. Because speech and language development is often closely related to hearing, there are many children who have congenital CMV who also benefit from speech and language therapy. CMV can also cause some changes in the eyes, and so children should have their eyesight checked regularly by an ophthalmologist. Congenital CMV can cause some changes in the brain. These changes may prompt children to be at higher risk for delays in brain development. They may be at higher risk for seizures or other conditions that are similar to that. And so oftentimes a neurologist or brain specialist participates in their care. And we don't want to forget the other aspects of therapy. So occupational therapists and physical therapists who help children with basically meeting those motor milestones, they're also a part of our team. And for children who have symptomatic congenital CMV and who are diagnosed early enough, there are some potential treatments with antiviral medications. And so we often consult infectious disease specialists to meet with families and discuss when and if a child is a candidate for that treatment.
That is so much. And I know you know this, and I've shared with our listeners in other podcast episodes, but I also have a daughter with congenital CMV. So she is going to be 3.5. Oh gosh, I guess she's going to be 4. Wow, time flies. So she's going to be 4 soon. You might hear her here in the background a little bit. But I know exactly what it's like to kind of go through this as a parent. Although, the way I went through this was a little bit different, as with my background in pediatrics. But I do distinctly remember just being overwhelmed. It is a lot to kind of process, especially in those newborn, first few weeks when just adjusting to a new baby at home is so hard and stressful. So then to add on all of these different appointments and unknowns, I just think it's important to acknowledge that this can be a lot for families. So, with that in mind, I really encourage families to take advantage and interact with social workers or counselors if they're available. Often through some of these subspecialty clinics, they'll have these individuals available. And it can be really helpful to have someone just to talk to kind of process all of these emotions for parents themselves and also siblings who are still, children themselves. So overall, many people find family counseling just adapting to this new normal very, very helpful. I think also with CMV, there's a lot of unknown, and that uncertainty can be tough to deal with. So I think I really encourage families to connect with specialists or counselors that can support them in that. And another key thing, and I sometimes see parents trying to manage all of this themselves. And I think it's really important to identify that point person. Like, who is, I always say, like the quarterback, who is quarterbacking, who's the point person for my child's care? And you mentioned this earlier. Most often it's going to be the pediatrician or primary care doctor. For some kids, that's a family medicine practitioner, which is also fine. Of course, it's the person, your PCP, the person that's your child's regular doctor. But some PCPs may not know much about congenital CMV. So I think it's really important for parents to ask, who is the point person? Ask your PCP, are you comfortable being the point person for this? Because if they're not, I think then it's important to kind of identify who is going to take the lead on coordinating care. Who's my go-to on this? And sometimes parents may feel like they have 8 different people calling them and don't know where to turn. So having kind of that person who's your go-to in the medical team to help kind of field these questions, I really just think that's so critical.
Absolutely. One of the most important aspects of this multidisciplinary or team-based care is communication between the team members. So There are some ways that families can help with this process, such as trying to ask questions and not hesitate. If there's something that isn't making sense or you're not quite sure if this is the right plan, to ask your point person, your pediatrician or family medicine doctor. And another thing that parents can find helpful is maybe even keeping a written notebook, a journal, a diary, and writing down questions in advance, because oftentimes having a young child present during an appointment, there can be a lot of things going on in that examining room. And so having some questions prepared and written down beforehand may make things go a little bit more smoothly, because we don't want to miss anything. And it's also important for parents to feel like that they can advocate for their child. I think that one resource that can be helpful for families to feel more connected can be some social networks to reach out and realize that there are other families that are going through the same types of experiences. If parents choose to use these resources, I would encourage them to also remember that every child is different and every family is different. So it can be tempting to compare one particular child's outcome with your child, but every child has a different journey when it comes to congenital CMV. And so just because things are going differently for you and your child does not mean that anything is going wrong. In terms of access, one thing that has become more available during the pandemic, the COVID pandemic, has been the use of telemedicine. And so some families may be able to take advantage of these resources as well to determine if they can see a CMV specialist remotely or virtually. And I know that not everybody lives close to a major urban center. And so using those telehealth resources may be another option for families to feel more connected and better able to identify the therapies that they need.
That is such an awesome point. And honestly, even families who do live right close to a hospital, telehealth, I guess I should say, medicine, it can just really lower the barriers to access. For those of you who have done any like telemedicine appointments before, you're not searching for parking, getting your kid in the stroller and bringing them upstairs, and, actually also lowering risk to any sort of germs that might be in the hospital or in those clinics. So I think telehealth is huge and just so important, and can really help, keep those connections with those providers. And I also wanted to say, I love what you said about, social networks and social media. I really turned to that when my daughter was diagnosed. And there's another little girl I know. Well, I met her mom through social media. They live in Texas, and her daughter is the same age as my daughter. And so it's kind of been neat to watch them over the years. And yeah, their journeys are very different. And even though on paper, they kind of look the same when they were babies, their strengths and weaknesses. It's really been interesting to kind of watch her grow up and check in with her mom, and just like so many shared experiences. So that's really been helpful for me. I've really liked platforms where you're able to kind of choose who you connect with versus like some of the kind of bigger groups I've found to be a little overwhelming at times. But everyone, like you said, it's different for every kid. It's different for every family. And, really, I think underlying all of this is the need to make sure parents are taking care of themselves. So, like, we've just put so much on ourselves as a parent in general. I don't know about you, but for me, like getting dinner on the table every night feels like a miracle sometimes. It's just so tough. So, I think remembering to do whatever parents need to take care of themselves. So, talking to other parents, support groups, is seeking mental health services if needed, even just like making some space for yourself, like doing things you love, and not necessarily devoting every waking moment to the kids, to, healthcare. It is all a bit overwhelming, but I can tell you, and for any parents out there who are kind of newer to this journey, it seems really overwhelming at first, but it does get better. And CMV is a manageable condition. Things might not completely resolve, like hearing loss, for instance, but there are some fantastic resources out there. And we found ourselves now, almost 4 years into this journey, like beginning to live normal lives. And we're learning more and more about CMV every day. So we really want people to be educated about it. And we want our families and kids affected by CMV to thrive.
Absolutely. I think everything that you said just now is so important for our listeners to hear. I think the important message is that the support system is really in place to help each child get to where they need to be. And that may be different for each child and each family. It can be a bit of a different journey along the way.
I couldn't agree more. Dr. Purcell, thank you so much for joining me today. This was really great.
Thank you. It was a pleasure being here today.
And thank you to our listeners as well. I hope you'll listen to further episodes.